To do the beta peel, you're going to need the following products on your trolley: tripeptide cleanser, barrier repair cream, and antioxidant. Your beta peel of choice, depending on what concentration, you would use the same process. You're going to use petrolatum gel just to block out any sensitive areas. You will need gauze, and I suggest that you use woven gauze. And then you're going to need your syringe to draw up the peel, and you'll need a glove to apply the peel. This peel is self-neutralizing, so there is no use for tri-active or neutralizing wash. You will see that the peel will reach a point where it stops working, and you will then just rinse it off and go to aftercare. We're doing the beta peel on Pumi today, and the reason why we've chosen beta peel for her skin is that she's struggling with breakouts, and she also has a little bit of post-inflammatory hyperpigmentation that we are hoping that we'll be able to peel off with this peel. She is prepared for it. It is a slightly uncomfortable peel. So we're going to talk her through the process, but she'll be fine. So we're going to start off our process by using tripeptide cleanser. I'm going to use around 2 ml of the gel, and we're applying it with wet hands. Tripeptide cleanser contains 2% salicylic acid, so it will prepare the skin for the beta peel, and we will be able to remove some of the oils on top of Pumi's skin. So we want to have a 2-minute contact time with this cleanser. Just adding a little bit more water so that I can get a little bit more foam out of it. This cleanser we don't use over the eyes because of the 2% salicylic acid. It will dry out Pumi's eyes. So if we wanted to remove eye makeup, we would use neutralizing wash to do that. We're going to remove the cleanser with our wet sponges. If Pumi did have quite a lot of makeup on, we would do a second cleanse, but generally it's not necessary to do double cleansing with this treatment. On a very oily skin, we would do a degrease at this point. Pumi's skin is not oily at the moment, so we're not going to apply a degreasing agent. Our skin prep solution is our degreasing agent. We'll use a gauze just to do a light wipe with the skin prep over the skin. You do not have to do an aggressive degrease when you are using beta peel. Pumi's skin is now ready for the peel, so our next step will be to draw up our beta peel for this procedure. Our peel comes in a safety bottle, so make sure that you press down when opening. Then you're going to lightly click your syringe into your peel bottle, turn it over, and draw up your peel. Now for this peel, the volume is quite high. We need 3.75 ml for 1 layer, and that would be enough to do her face. Support and remove the syringe. Make sure that you then close your bottle properly by pressing down until your lid locks. I am going to use a glove for this procedure because I'm going to be using gauze to apply this treatment. So if you do too many procedures with your hands, you will find that your fingers do peel a little bit. So I've got my folded up gauze in my bowl. I'm just going to, away from my client, dispense of my peel onto the gauze. Do not do this procedure until you're ready to use the peel because it will evaporate. Now, the base for this treatment is very volatile and it does evaporate. So we're going to be applying it reasonably quickly and warn the client that there is a little bit of an alcohol smell to the process. So take your gauze out of your bowl, just press it a little bit for any excess that's in your bowl. Put your bowl away from your patient. Then you're going to do a quick application. You've got 30 seconds before it starts burning on her skin. Alright, fumes are reasonably hectic. Alright, I want to do your lip. Okay, you okay? Alright, and then we're going to go underneath the chin, into neck, and we're going to wait a little bit. Now you will notice what I'm just doing is I'm just applying where I can see it's not penetrating well. Pumi, are you okay? Must I fan you? Okay, we generally don't fan because we don't want to evaporate the peel too quickly, but Pumi's struggling, so we're going to be fanning her. Better? Does it calm down? A bit? Completely calm down? Must I fan still? You're alright, okay. Talk your client through this because it is quite uncomfortable. So what we're not going to do is we're not going to remove the peel because otherwise it doesn't do its work. But do definitely talk your client through it. How are you feeling? Is it calming down?
A bit, just a bit.
Okay, nice big deep breaths. Good. Try and relax your shoulders. Okay. Did it calm down? Okay. Right, that was just a little bit of residue of the peel. This is a little bit of residue of the actual gauze, so that's not frosting. But what you'll notice on her skin is this difference in the texture. That shows that her skin is neutralized. You can see it obviously here on her jawline. So what we're seeing here is pseudo frosting. This is crystal of the salicylic acid that is neutralized on her skin. So I know that this peel is neutralized by the fact that I can see these crystals. What we look for with a beta peel is when you touch the skin that you get this crinkling result. It's very obvious here on the side of her face. So we know that we've created a little bit of damage in the epidermis and that skin will peel off. This peel does have some social downtime involved with it. So please don't do it before important balls or boardroom meetings, or definitely not directly before a wedding. Okay, all calm down.
Yes.
All calm down, good. Now, what I also love about this peel is the fact that it will indicate where you've put it. So you can see here, I've missed a little spot on Pumi's nose. I'm reasonably sure I'm not going to redo it. She's not going to want me to hurt her that way. But you could add a little bit more to the area. If you were doing a second or a third peel, you could add more product. You could do another layer because this peel is layer dependent. How you would do that is using the same piece of gauze, draw up 2 mils and apply in the same way and wait for the peel to calm down. But we're not going to bully Pumi that way today. We're just going to go straight into removal and aftercare. Please do not add masks or serums to this peel because it will affect your peeling. What we're going to do, however, is we do remove the crystal. So with our wet sponges, we're just going to remove the pseudo frosting. There's a little bit of residue in her forehead. There are a little bit of crystals on her forehead, but that's all good. No neutralization required. What you might see when you take the peel off is that there's some of the areas of congestion that are still filled with crystals. That's good. That's just going to push out. Then we're going to put on our barrier repair cream because we want to replace some lipid at least. You could also add retinol to this peel when you're doing subsequent peels, definitely not on a first peeler, to give you a little bit more peel. So this will calm down Pumi's skin nicely. She'll feel less tight. We're just going to massage that into her skin. And of course, we always want to apply sunscreen. So even if you are leaving the skin a little bit drier, you will apply sunscreen. You might leave the barrier out if you want a little bit more peeling, but I definitely only do that on subsequent treatments. Alright, so we're applying the sunscreen. You will notice that it does seem a little bit graying when we put it on, but it definitely does absorb very nicely into the skin and doesn't leave any grayness on the skin because we don't use any zinc and titanium in our sunscreens. Now, very importantly with a beta peel is that your client will use barrier repair cream for 3 to 5 days, or definitely in the process while they are peeling. They stop all their active ingredients and go to barrier repair cream with their cleanser. They might use brighter concentrate if they're on that, but otherwise there's no need for any active products. Please ensure that your client also doesn't use any peeling agents or exfoliators, definitely no retinoids, and that you educate her not to pick any of the dry skin off, as that forms a barrier to the world and will help her skin underneath heal. So it must come off naturally. Definitely still apply your sunscreen daily.